attention in these children. So we saw two causes, one is neurotransmitters, one is genetic. Okay? Then let us go ahead. It is not only a single gene, don't be mistaken, not only a single gene, it is a polygenic inheritance, which means a number of genes are involved in causing ADHD. It is highly heritable. If ADHD is there in parents or grandparents, there are high chances that a child is going to suffer with ADHD. This is another concept which has been coming up recently, ADHD and gut microbiome. So what is this exactly? Neuroactive molecules like GABA, serotonin, dopamine, noradrenaline, histamine are produced by the gut microbiota, and these influence the gut-brain axis. Okay? And gut health promoting bacteria. There are a few bacteria which have been identified and which are deficient in the children with NDD. Okay, so why this is important? Because the implication is that in early childhood or infancy or even during pregnancy, when the mother or in early infancy in the child, there is a use of antibiotics, the gut-brain axis has been impaired. There is dysbiosis, which increases the chance that the child will suffer with ADHD. Or stressors. So what are stressors? Either it could be the emotional stress the parent faces or the child faces, or it could be physical trauma. And dysbiosis as a cause of ADHD. So it is either ways, either first the neurotransmitters are faulty and then it is affecting the gut, or the gut is faulty and it is affecting the brain. So it goes either ways. Other possible causes of ADHD: prenatal stress of mother, alcohol or nicotine consumption during pregnancy, exposure to chemicals, childhood stressors. Most important cause which I have seen in my cases is that either there is some issue with the parenting, or it is a single parent, the father is absent, there is a divorce happening in the family, or the child is staying separate away from the parents. So these are the scenarios.
She's the teacher, she's teaching me, okay? She's the
it is
teacher.
most common that ADHD is prevalent. How do we diagnose ADHD? Is every child who is showing up symptoms of impulsiveness having ADHD?
No.
No, it's not so. So what is the criteria? It is a trio of inattention, hyperactivity and impulsiveness, and it should be diagnosed by the age of 12 years if there is significant impairment to daily functioning, and it must not be better explained by any other mental disorder. So these are the criteria, and if the child is fitting into this criteria, you can officially term him as ADHD child. These are the 18 common symptoms which are given in DSM-5.
A lot of kids have this, see the symptoms.
So these symptoms have to be present for more than 6 months duration and impairing the functioning of the child. These are the 3 types of ADHD: inattentive, hyperactive, impulsive, and it is a combination. So we can get the child who first fits into either of this. So we have seen different causes. First is the genetics causing impairment in the neurotransmitters, and the other causes, possible causes. So is it, why this is necessary? Because when we understand the probable causes, then we can base the management on those causes, right? So timely management is the key, and the different therapies or treatment methods which are available are pharmacological treatment or homeopathic treatment, diet, PT, OT, behavior modification, speech therapy, SE, vocational training. So it has to be an integrated approach in these children. It is not a single cause, remember. So a single treatment cannot suffice these children. So what is the need for homeopathy? So stimulant medications like Ritalin, which are beneficial, but they come with side effects. So children often come to us with, they are becoming drowsy, they are not showing interest in anything, but we do not want the child to be in this state, right? So other thing is that the behavioral therapy becomes a challenge as the child is inattentive or too restless. So then the parents come to us, the child is not cooperating in therapies, okay? Then dietary modification is there, it has good results, but these are temporary. Why? Because compliance with such exclusion diet, it becomes a challenge for the parents, right? So it gives rise to various deficiency syndromes in these children. So finally, homeopathy, Why is it popular? Because no improvement is seen with conventional therapy or treatment, or the parents come to us with side effects of conventional treatment. This is when they approach to us for homeopathy. So they have already used allopathy and they have come to us. Also, homeopathy is pocket friendly, as we all know, and children love these medicines. So what are the typical complaints by parents of ADHD kids? So this is a scenario of an OPD where there are so many parents coming, but only these kids are there. They hardly give any chance for the parent to speak. They are too restless. They are throwing tantrums there itself on the floor. Okay, they are pushing the chair. They are not allowing the parent to talk. They are pulling the parent. In such a scenario, we have to take the case, observe the child, analyze the case, and prescribe. So these are the different presentations to us. That the child is never getting tired, excessive impulsiveness, destructive tendencies, tantrums, everything. The parents really feel embarrassed and they cry in front of us. It is difficult for us to engage them or manage them. They get unusual strength during tantrums. Please reduce this hyper behavior of the child. That is the request made by the parents. They remain active past sleep time and often become difficult and unmanageable at night. Their sleep is usually restless. Imagine the plight of a parent. Throughout the day they are behind this child. Night they are not getting rest. The child is restless. The parents are totally weakened. We have changed the school so many times as they are not allowing him in school. Academic underperformance. He is not cooperative for therapies. So if he is not going for therapies, then how can we help the child? So these are the typical complaints. So what do we do with such children? So what are the objectives of treatment? Now we have seen that it is a genetic disease. Being a genetic disease, we have to understand the scope of homeopathy in a genetic disease. So it is not curable. We have to understand and keep it in mind that ADHD is not a curable disease. It is an incurable disease and we have to treat the patient. But to what extent? How many days? And when should we stop treatment? So these are the questions which come up. So let us see what is happening over here. So what is our main objective of treatment? Reducing the problematic behaviors. Okay. So the child is stopping self-harm. He is not doing any aggressive things. He is not restless. The hyperness has come down. This is one objective. Second objective, enhance the adaptive behaviors in the child, like social skills, communicative skills, imaginative behavior, etc. Treat any comorbid conditions like epilepsy, GI issues, insomnia, tonsillitis or URTS. And overall, we have to improve the quality of life of the patient. So that as this ADHD child is growing up, he is able to adapt well in the society, right? And finally, trying to rehabilitate them into the mainstream society. So as much as possible, the child is near normal, he is able to cope up well in all his daily functioning. That is our objective. So let us go with one case. This is one of the cases I have encountered over there. So this is a child of 5.2 years old. He is a male child who has come with complaints of poor attention span with sitting tolerance of only 5 minutes. Imagine, only 5 minutes. He has poor concentration, poor eye contact, echolalia, inability to follow multiple instructions. He is obstinate. He has temper tantrums, banging head when angry. And behavior at school, trying to hit children, aggression. So he is not even going to school properly. Tends to pass stools only in the diapers. 5.5-year-old kid, he has this habit of passing stools only in diapers and bedwetting. So imagine the plight of this parent. And this parent was a nurse. She was much aware of this condition when she came to me. And she did not want to start allopathy because she knew the adverse effects of allopathic lifespace. After his birth, he was brought up by his grandparents and father due to mother's work priorities for a period of 9 to 10 months. So the child has been away from the mother for 9 to 10 months. During this period, he was also vaccinated. Okay. Later, he developed influenza and was seriously down with loose motions and fever for 1 month. So we are seeing a sequence of causes which are happening. Can we make out which is the cause? We cannot make out exactly what is the cause for ADHD in this child. He was given a lot of antibiotics during this period. So this we have seen back in the background when I said that because of antibiotics, the gut-brain axis is impaired, right? He is generally an affectionate and caring child.
Antibiotic.
Okay. So this is his life space, and with this in the backdrop, these are his physical generals. He is thermally chilly, cravings for cold drinks and ice creams. Observations: the child would enter the OPD with a smiling face. Whenever I would ask anything, he would reply something irrelevant, broken words, unclear speech. Okay? So at this point of time, we also don't feel like connecting with the child. Imagine how the child is going to survive in the society. So mother's history during pregnancy, uneventful. There was single live birth after 5 years before this child. Physical milestones have been normal. Only speech was delayed. This is another characteristic and important symptom we need to understand. At 9 months of age, the child had history of influenza and prominent continuous loose motions with high grade fever. Vaccination, he was vaccinated. Family history: mother has hypothyroidism, father has asthma. Paternal uncle and grandfather suffered with cancer. So these are the tests. Generally the child comes to us after getting evaluated. So DA is the developmental age. So his chronological age is 5.2 years, his developmental age is 2.9 years, social age is 2.7 years. So that is where his mind is. And developmental quotient 66 and social quotient 60. This is at the beginning of treatment. I mean before starting with the homeopathic treatment. So how do we analyze this case? So these are the things I have taken into consideration. So clinico-pathological and genetic correlation along with biological, psychological and social axis. So let us just go through the follow-ups. So we started with the treatment in September 2022 where he has given us a history of disturbance, gastric disturbance. Then there is a family history of asthma, hyperactivity, restlessness, overstimulated nervous system. So based on these symptoms, I have given him Etuzah-Cynapium 200 weekly 1 dose with a family history of asthma and hypothyroidism, psychotic background, Bujamanyam, 1 dose every 15 days. Hyperactivity and restlessness, I have given Calcarea for 6x, 2 tablets thrice a day, and overstimulated nervous system, which is led by Passiflora, right? So after, he has come after 1.5 months, where we see the change now. He is trying to respond to questions. He is showing improved socialization skills, able to recognize people and his friends. His school teacher comments that he is behaving normal and much better than other kids. Pet fetish has come down.
She's teaching.
Then again after 1.5 months, anger is seen but no tantrums. Sitting tolerance has improved to 45 minutes, which was 5 minutes, it has come to 45 minutes. Able to follow 3 to 4 instructions at a time, improvement in his eye contact is seen. Then again after 3 months, flapping. Again this symptom has come up, flapping from overexcitement, fear of reprimands, fear of teachers. Used to have sensitivity to sounds few years back, now little less. Habit of rubbing genitalia. So this is a new symptom which has come up. Craving ice creams and sweets. Here I have given Calcarea for 200 once a week as a constitutional. Etuzah-Cynapium 200 once a week. Passiflora Q, I have continued. So we have to understand that every time the presentation will change. So we need not change our prescription accordingly. If the intensity of the symptom is more, we need to give some remedy to address that symptom. So again after 2 months, the flapping of hands is still there. Habit of rubbing genitalia is still there. Habit of passing stools is still there. No noise sensitivity, no bedwetting. So here I thought that the constitutional has not helped him. So that's the reason I gave Stramonium 200 for 1 week. Then as a supportive I have given Calcarea for 6s and Passiflora Q. Again after a month, so flapping of hands nil, rubbing of genitals nil. So I have continued with Stramonium for another week. And again the constitutional features, so Calcarea Force again once a week we have given and supportive medicines. Then he had an episode of enteritis in between for which he took antibiotics. And generally we should understand that after taking antibiotics, these children again revert back. So again the hyperactivity symptoms come up. The old behavioral issues of aggression, shouting, crying, self-hurting behavior have come up. So here I have given sulfur to antidote the effect of antibiotics. The habit of passing stools in diapers has come down. he has started to go to the washroom, which was again a welcome sign by the parent. She was so happy with this. Then again we have given Calcare-Force 200 once a week, and the supportive medicines have still been continued. Again, after 2 months, socialization has improved, sensitivity to sounds and textures has come down, habit of hand flapping has come down totally, no bedwetting, no habit of rubbing genitalia, and no habit of passing stools and diapers. So almost all the symptoms of the child have come down. So have continued the same thing, constitutional along with the supportive medicines.
Yeah.
Now again she has come up with getting angry only on mother when restricted or denied anything. At school he is able to sit for 6 hours.
Wow.
Imagine the first presentation
Yes.
and now. So he is able to sit for 6 hours. When at home and not engaged, he is restless and he roams about. So these children need to be continually engaged in some activity.
Beautiful case. Wow.
So same prescriptions have continued. So we see that the problem areas in these ADHD child were the main behavioral symptoms and the higher functions and sensory issues. And homeopathic treatment has helped to combat all these symptoms effectively. So we
Oh,
see
he's the naughty
of
kid.
the
See,
child.
Avini, see the naughty kid, Avini. He's an ADHD kid. I also have some very naughty patient. I was scared of them. Yeah, when you do here, it focuses. That's right. See, before treatment, RX is treatment, doctor. See, AC is learning AC. He got a star also,
This
that
is
baby.
before treatment where we can see how restless and fidgety the child is.
See, that baby is too restless. See, he's got some kind of disease. Are you seeing that?
So
See,
the
see,
mother
he's
is
so
trying
naughty.
to tell him to write something and he is not concentrating at all.
That's a sad thing. Now see the baby, how much benefit this
This
baby
is
got.
at his school. Again before treatment.
Oh, he's so naughty, baby.
So with such a child, even therapies become really challenging.
Yeah. You see, such naughty kid. Do you see that? Yeah. With homeopathy, we can make such kid peaceful. Okay.
Right? Look at his behavior, look at the way he is laughing. He is not able to connect with whatever we are trying to tell him or instruct him.
Move it away from my nose.
Okay, I'm sorry.
This is one more video from his school.
Let it see the entire screen.
So not at all manageable at school. And this is the latest follow-up. If you can see the child, you see the change in
Looks
his
normal, yeah.
body language.
Morning is better safety program.
Wow.
Teachers, on your friend. Myself, Moshkota. I'm studying in first class in the above dimension.
Beautiful, amazing case. Wow.
Symbol.
National game,
Hockey.
national flag,
Tiranga.
national currency,
Indian rupees.
national
Can you clap for
river,
me, baby?
Ganga.
national animal,
Bengal tiger.
national bird,
Peacock?
Peacock.
national tree,
Banyan tree.
national flower,
Lotus.
Lotus.
national anthem,
Jeragalamana.
national song,
Vande Mataram.
national motto,
Satyameva Jayate.
national calendar,
Indian Key Cobra.
national calendar, summer calendar,
Satyakanga.
national extinct animal,
This is what was the change which we were